Hey, my name is Badass Benny and welcome to my channel. If you're an ACE, AMAC, or sex human trafficking survivor, you're in the right place. And it won't cost you a penny to like and subscribe worldwide. And please leave a comment. Today we're going to talk about adult male patients, the psychological reactions. Both heterosexual and homosexual males can be victims of sexual assault. Physical force is almost always used on male victims, and the level of physical brutality appears to be greater than for females. Also, a greater likelihood of multiple perpetrators exists for male than female victims. Reports on male sexual victimization are rare, as male victims are reluctant to disclose sexual assault for three major reasons. Societal beliefs that a man is expected to be able to defend himself, especially against sexual assault. The victim's fear that his sexual preference may become suspect, and men are taught to be in control of their emotions, and disclosure is highly stressful. So you get cops that don't believe, or um, at a higher rate than women when they're doing the sexual assault kits or when they're doing the interviews. Men may experience the attack as an assault on their masculinity and strength. As a result, may reject assistance that makes them feel weak or vulnerable. The crisis reactions of males progress through similar stages of emotional adjustment as adult females experiencing rape trauma syndrome. So in the DSM 5, there are anxiety disorders like 309.30, 309.31, same thing in the women. Rape trauma syndrome has two phases, the immediate or acute phase and the long-term reorganization or assimilation phase. Immediate crises reactions or emotional and behavioral stress reactions indicate the acute phase include numbness, shock and disbelief, dazed or bewildered presentation, diminished alertness, cognitive confusion, flat affect, psychological distancing and preoccupation, dulled sensory, affective, and memory functions, feelings of terror, fearfulness, anxiety, or hysteria, outward calm and collectedness. B. Subsequent emotional reactions. Emotional and behavioral stress reactions may last for several months or even years and cause significant disruption in the victim's life. And this is the man. Include continuing fear, anxiety, sense of helplessness, persistent fear or depression, mood swings, denial. Once you can get over denial that you've been raped, you have a chance to heal. Sleep disturbances, vivid dreams, recurrent nightmares, insomnia, and wakefulness. Somatic symptoms, appetite disturbances, poor concentration, preoccupation with event including flashbacks, self-blame, guilt, and shame, sexual dysfunction, depressive symptoms, phobic reactions, withdrawal from peers and friends. C. Supportive approach, crisis intervention theory, which describes clusters of emotions preceding the phases of acute crises. Reintegration or crisis resolution and normalization provides a theoretical framework for understanding and responding to the patient. Psychological reactions may be experienced with varying degrees of intensity as a person progresses through each stage of emotional adjustment. Cultural differences, life stage issues, mental or physical disabilities, and previous victimization may intensify the psychological trauma experienced by the patient. Developmentally disabled, hearing impaired, and other handicapped individuals are especially at risk for sexual victimization, require particularly sensitive treatment. And back then, statistics change, but it could be 95 to 98% of special needs folks get raped from 18 and under. It's pretty high, and even over, especially if they've been raped before as a child. Cultural differences, we talked about that. Examining practitioners must demonstrate non-judgmental, sympathetic approaches to assist with the reduction of the acute psychological trauma and its after effects. See the state of California Medical Protocol Information Guide for additional information on psychological and social cultural factors. So what are you going to do to take care of yourself, man?